guys, welcome to my YouTube space where I talk about lifestyle, travel, and random reactions. And today I'm gonna share you my recent experience about Lasik surgery. But before I share you what I went through, I'll walk you first to what is Lasik. So what is Lasik? Lasik is a surgical operation to reshape the cornea for correction of myopia, farsightedness, or astigmatism, in which the surface layer of the cornea is separated to create a hinge flap, providing an access to the inner cornea where varying amounts of tissue are removed by an excimer laser. There are three kinds of Lasik, which are PRK, FEMTO, and Relic Smile. FEMTO is commonly performed worldwide with an excellent post-operative result. It creates a flap with a laser on the surface of the cornea, and then with another laser, which is the excimer, the inner surface of the cornea is optimally adjusted to achieve the best vision. Last, the flap is returned to its original position. FEMTO also is cheaper than Relic Smile but more expensive than PRK. It has less downtime and less pain. You guys are probably wondering, why did I get LASIK surgery? Well, even though my eye grade is not that high or is not that strong, I have astigmatism. One eye is 150 and one eye is 125 or 175, something like that. That means it's hard for me to focus if I wanted to read things or letters or text from afar. So if you notice, if I'm at work and I did not say hi to you, that's probably what it is. I couldn't see you. Aside from the fact that I could not see clearly from afar, it's hard for me to focus and it gives me headache. My eyes get tired very fast just because I couldn't see clearly. I have been using eyeglasses and contact lens for a long time, for probably 7 to 8 years already. Wearing contact lens and eyeglasses has its own disadvantage. If I wear a glass, I can only see from here, your periphery is still blurry. If you're wearing contact lens, you cannot maintain it. There are times that it gets dry. When it's dry, it has its effects to your eyes also. And also, contact lens maintenance can be very expensive. But BAHT eyes is over. I got my LASIK done last month, May 21st, at Rutland Gimbal LASIK Center. I highly recommend that clinic, especially if you guys are dealing with your beautiful eyes. Rutland Eye Hospital is Thailand's first medical center specializing exclusively in the field of ophthalmology. With over 55 years of experience, its reputation based on the superb quality of care remains unique and unrivaled. It's located at Q House Building, 16th floor, Asok, Sukhumvit 21, here in Bangkok. So how much is LASIK surgery? For where I went, there's a price for one eye and there's a price for two eyes, but I got two eyes, of course. For Relic Smile, it's 120,000 for both eyes, since this is the newest technology. For FEMTO, it's 99,000 baht for both of your eyes, and the PRK is around 70,000 for both eyes. Actually, I called a lot of clinics about LASIK surgery. There are clinics here in Bangkok that offers that procedure very cheap. Why are they cheap? Are they using blade up for my eyes? LASIK surgery. I also asked some, international hospital for LASIK surgery, big hospitals for LASIK surgery, and I came across with Rutland Gimbal. You have to consider a lot of things before you even go through or before you even decide which clinic you want to go to. Of course, I'm scared. What if my vision will be gone? What if I couldn't see anymore? All these things. What if my eyes gets bigger? I even have that thoughts. I went for the best clinic just to ease that discomfort in my head, my fear of going through surgery, because that's your eye. You don't want to lose your eyes, right? I was able to talk to one of the personnel in Rutland Gimbal LASIK Center, which they professionally explained to me everything through Facebook Messenger. That actually gives me a lot of comfort already, because they are very professional in handling their patients. They speak very, very good English in Rutland. That also ease my worries that, oh, do they understand what I'm trying to say? Or I understood what they're trying to say. That's very, very important. I book an appointment with Rutland Gimbal Lasik Center. Take note, you're not just gonna walk in and I tell them that I want my LASIK done. No. I book an appointment with them. They schedule me for an assessment. They need your eyes assessment. It will give them an idea what kind of LASIK surgery you are more suitable for. The eye assessment cost 1,500 baht. It took me 2 to 3 hours to finish the whole assessment. Of course, that depends if there's a lot of people there. I was the only patient actually, and it took me 2 to 3 hours. They did a lot of tests for my eyes. I underwent series of eye assessment like tear film test, corneal topography. Corneal topography. This is to see the measurement of your cornea. They even put eye solution into my eye to dilate and see if I can see it from afar. I can see it near me. There are times that it was so blurry that I couldn't see anything. I trusted them so much that I know they know what they're doing. After the assessment, the doctor, which is your surgeon also, will be there to evaluate and explain to you thoroughly what those assessments are. My doctor is very, very accommodating. She speaks real good English too. She explained to me what are the difference LASIK surgery, the PRK, FEMTO, and Relax Eye Smile. She explained to me all the procedure, what I'm gonna go through. She also explained to me the rare complications. She's basically going to let you know what are the expectations pre, during, and post-surgery. After my eye assessment, I decided finally to get the LASIK surgery. I got FEMTO LASIK, which is the most common worldwide procedure for LASIK. On the day of my LASIK surgery, they asked me to wear button shirt because you don't want to wear a shirt that will touch your eyes later on after the surgery. They asked me also to not drive, which I don't drive in Bangkok, and have someone there for you to assist you after the surgery. Do not use perfume on the day of your surgery because that might affect your eyes. Your eyes might find it strong and irritate your eyes after your surgery. Do not wear eyeshadow, eyeliner, mascara on the day of your surgery. And remember, by this time, you should stop wearing your contact lens 7 days prior on your surgery day. Actually, the surgery itself, it takes minutes, like 10 minutes. But because they have to prepare everything, all the things that they need inside the surgery room, it takes a little bit of a while. They dressed me in a surgical scrubs for patients. Of course, I have my mask on, and they put a tape on top of my mask just so I don't blow air towards my eyes while they're doing the surgery. They check again my eyes before I go inside the surgery room. The surgeon also meet me before I go inside the surgery room. She explained things again to me, and then I think she noticed that I'm a little bit nervous, so she gave me an anxiety pill to calm me down. So I went inside the surgery room, lay down. There's like 6 people inside the room taking care of you. One surgeon and another doctor that manipulating the machine, the laser machine. 4 nurses. So the doctor is the one above my head while I'm laying down. She's the one above my head. She's the one I'm actually can see. And then I'm directly looking at this laser machine. So while laying down, I'm seeing this light. They asked me to look at this light. Just focus on that light. The first machine, the first laser machine, was the one that will put a flap on the surface of your cornea and open it. They started from my right eye, and then next is my left eye. I guess the experience during that time, it does make me scared because there's like 3 seconds, 4 seconds that I couldn't see. I can see lights, but not clearly. And I was not freaking out, but I'm a little bit scared. And then after they opened my eyes, When I say open, it's just the surface. It's just this like surface on your cornea. They make a flap to open it. It's like a cover, right? They open it. And then the next machine was the excimer. This is the laser that will correct your vision. Actually, that is just 5 seconds each eye. They asked me to open my eyes, they put some liquid onto my eye, and then asked me to focus on this light, and then I did, and then 5 seconds. Then they switched to my other eye. The most scary is not even the laser, it's the sound of the machine because it's very loud. And then they asked me to stand up. They check again my vision. They have to check if the flap were placed nicely back onto my eyes. They put a cover on my eye. They put this cover on my eye like that, so I look like a bee after my surgery. That's how I look like with the tape and a mask. Yeah, I can totally rob a bank after this, after that. And then I went home. After my surgery, the first thing that I've noticed is my eyes were very teary. My eyes were very wet. It's not painful. No, it's not painful, but it's very wet, I would say. It keeps crying, but I can see. I can see immediately after the surgery. My vision was crazy clear after my surgery. They also give me a sleeping pill, which I love. They give me 2 sleeping pills. They give me a painkiller as needed, stat only when you need it, and they ask me to rest as soon as I get home. I sleep for 4 hours with that thing on my eyes. So I was sleeping like this. Yeah, with the tape here. And when I wake up, so I just woke up from a nap, and before I napped, it was very teary, like involuntarily my eyes were so wet. But that's expected also, so that's why they ask you to sleep or rest after the surgery. Now I feel like there's sand inside my eyes, but that's also expected. The funny part is I can see far, but right now, like reading right on my face, it's still a little bit blurry, but the doctor said that's also normal, and tomorrow it will get better. So I already put something on my eye for the dryness. The reason why there's like a sand feels like there's a sand on my eye is in my eye because of the dryness. So let's see tomorrow. I can see better when I wake up. It gets more clearer and clearer in time. You have to wear a protective glass every time you have to sleep. So they also gave me this. This is what I was wearing the whole time if I need to sleep at night, because you don't know, when you sleep you scratch your eyes and the next thing you know your eyes are irritated and infected. So I was using this the whole time I was sleeping, so I couldn't reach my eyes from here and here. So this is really good. They will give it to you anyway. It's part of your post-surgery kit. So that's that. Then you have to go back to the clinic the next day. They will check again your eyes if the flap are still there or still in place, and how's your eye recovery. After the surgery, every time you have to go out, you have to wear sunglasses. You have to protect your eyes all the time, every time you have to go outside. Protect from the sun and protect from the foreign objects that might touch your eyes or in contact on your eyes. They also gave me an antibiotic, and you have to put that in your eye for at least a week. They also gave me this artificial tears for your eyes in case it gets dry, and you need to use this for 2 to 3 months after your surgery. So after my surgery, I cannot wash my face for 2 to 3 days. That's the time your eyes are healing. You cannot put makeup on your eye during this time. You can put makeup on after a week. You cannot swim. You cannot exercise, any contact exercise like boxing and stuff like that, sports, because you don't want to, anything to touch your eyes like strongly. But your eyes just gets clearer and clearer during this time. After the surgery, probably my eyes were 50% clear, and then the next day 70%, and then it gets better in time. Also, during the time that you have to recover, like a week to 2 weeks after your surgery, you have to rest. If your body is telling you to sleep, sleep. If your body is telling you to nap, nap. If your body is telling you to sit down, relax, do it. Because last time after my surgery, we flew to Koh Lanta. My eyes were not rested. My eyes are exposed to the too much sunlight, even though I was wearing sunglasses. But still, I wasn't able to rest, like the rest that I need to fully recover from surgery. Alright, to wrap this up, I would say LASIK surgery is one of the best investment I ever did for myself. I can clearly see now. It's always better to improve yourself, your health, your knowledge, your skills, and I'm very, very happy. So I actually recommend you guys to to save for this kind of self-improvement. It can be costly, but save for it. It's worth it. It's definitely worth it. Life-changing situation in your life in a positive way. So I guess it's time for you to fix your eyes. So thank you guys for watching. I hope you guys enjoyed my video, and I hope this video is very helpful and informative, and I hope I answered all your worries and questions about LASIK surgery. And if you guys like this kind of videos, don't forget to subscribe and turn on that notification bell for my next video. See you again, guys, and thank you.